All right, so today is the itchy day. Every time I see this stuff, I look at the bugs and everything. It makes me want to scratch and go back and forth like, is that in the bed? Is that here? With my daughter in the volleyball of the national club that I have her in, we have to travel all over the place, and it's hotel rooms everywhere, and I hate it. I sleep with all of my clothes on just because of I don't want to get something on me. But yeah, so that's the case there. So we're going to talk about the scabies, of the lice, of the fleas, of the bed bugs, and everything else. So let's start off with the scabies. Okay, so you will see on all of these things how it's talking about the sarcotes, scabi, and it's going to talk about all of the etiology stuff. I don't care. Scabies is scabies, okay? So you don't have to memorize those things, okay? Skin-to-skin contact, crowded of the living conditions, right? So it happens with some of the jails. It could happen in some dorms. It could be in BMT to where everyone is going to get it and just pass it around. I kid, it's not going to happen, but it could. These mites can actually just be outside of the burrows and everything that they're going to build to get into your skin. What are some of the locations? Okay, so we've got that on of our armpits, of our wrist, of our pubic region, of the elbows and of the knees, the feet, pretty much everywhere except for your face, okay? So, we'll see. So, the scabies mite creates of a burrow, of a tunnel, right? It's how you're going to see the primary lesion is where it starts. As far as of the burrow goes, that mite is at that end spot. Itching is worse at night. Like I said, the first lesion is where they start the burrow. Okay, oftentimes it is very, very, very itchy, and so the scratching is at that. If you were to do it immediately, then you could hurt that mite, and so it doesn't go, but it's not right away all of the itching is happened, so it runs away. Burrows 2 to 15 millimeters long, pink white, slightly elevated. As it's going, you can look like a black dot at the end of the burrow. So it can start with the primary lesion, and then it's going to start to crawl at the black dot is at the end of the burrow. How many times am I saying the word burrow? Most common location is the finger webs, the wrists, sides of hand and feet, penis, buttocks, scrotum. Yeah, God, don't be making tunnels in those areas. Adults, check the finger of the web spaces, okay? Secondary lesion is of the pinpoint erosions due to scratching. Diagnosis, burrows. Surface touch with felt tip marker. Wipe it with an alcohol swab, and the ink is absorbed to highlight where of the burrow is at. So if we think that it's the case, and we can't specifically see 100% of the burrow of the black dot, we can paint it, wipe it, and then it's going to pull that into the burrow, which is what you see of the top of the picture right there. The roof of the burrow of a blade transferred onto a slide, and then you're going to see what you can see right there. And then we talked about of the burrows and of the characteristic lesions of the black dot. That would be how we can make of the diagnosis. Treatment, permethrin, also known as Eli mite. It's kind of funny, but Eli mite. I didn't even think about that until right now. Eli. All right. So permethrin of the 5% apply at the bedtime to of the dry skin and of the toes. Leave on overnight and wash off in the AM. Retreat that in 7 days. Okay. Clothes, sheets, we gotta wash it all on hot stuff with everything that is in here about the scabies, the lice, the bed bugs. We're gonna talk about all of the cleaning of everything. Vacuum the mattress, the furniture, the carpet. Basically, you're gonna clean your whole damn house if you think that this is it. Not only are you gonna treat yourself, but you're gonna treat everyone else who is in of the home because of the fact that it could be the contact to contact. We can give them some of the antihistamines if they're having of the itching. If it is inflamed also, we can use the Eucerin, then use the permethrin again. If this is severe and we need to use some of the oral ivermectin, we would use that. Institutional, right? So, as I said before, of the jail, nursing homes, and if they're not adhering, if they're not healing up with permethrin, then we can use this as oral. 12 milligrams PO at day 1, wait a week, and take it again. Worsening symptoms 2 to 3 days after the oral therapy, then it's a non-therapy. We also have the Lindane, but you can see it up there, toxic. This can cause the seizures of the central nervous system. Individuals can't walk. It says on there it's not for the kids, pregnancy, nursing, all of that stuff. We're not going to use this, okay? Pre-treat with the steroids, apply to dry skin, sleep without clothes or the diaper that can occlude it. Don't retreat without the documentation of continuing active infestation. These are some of the pictures here now. So we can see of the initial of the lesion that is there, and then it would show us some of the burrows after. They're not always allowed to be seen of the burrow, and so that's the reason why we do the marker and wipe away to highlight it for us. Feet, web space there that we use for adults. You can see how there's some of the burrow on that. Guess it's the index finger. I'm just trying to figure that the thumb could be over there. Oh, let's see. That is what the burrow looks like. I would never want to see that. Go fast. All right. So Norwegian. Okay, I didn't even remember that it was called the Norwegian, so I actually had to look it up. And apparently, in the early of the 19th century, the first of a diagnosis was made in Norway. And so y'all have seen many times how there are things that are named after of the doctor or of the patient. So that's why it is like that. If we are having this, think HIV. Okay, it's a variant of scabies with thousands of mites. So it's the same thing, but thousands of the mites in this one. Highly contagious, Scales, significant crust, primarily hands and face. So you can see it on of the face on this picture. Next up we can see the hands, which looks, ugh. Here you can see all of the burrows there on of the abdomen, also on two of the axilla. So that is of scabies. Burrows. All right, so now let's talk about the lice, right? So you can have it on of the head, on of the core, and then also of the pubis area there. So these are some white fleck eggs, eggs on hair. That one is of a red of the papules on the neck. Then up next, it's on of the wrist and the ankles. Usually only in children if it is up onto some eyelashes. That can happen. Most is on of the head and hair. Eggs. Crab lice, red papules, excoriation in the groin and abdomen. Okay. Lice can be on of your head, but they can also be down into of your clothes. Okay. If we use of a wood's light, it'll be yellow-green to blue-green, which of the picture that we're going to show will be mostly of the blue-green. These can also be causing some of the lymphadenopathy. You can have some of the secondary infection. What do they look like? There they are, the white fleck eggs. There's that blue to green on fluorescence. So how does it start? This is skin-to-skin contact of the fomite to skin and also of the sexual of the contact. Management. Body lice can carry typhus and trench fever. Get rid of the lice by cleaning the clothes. Like I said, everything is going to be cleaning your damn house. Lice may survive 10 days up to 3 weeks on the location without you treating it. Permethrin. It's talking about also of the red, these lotions. The red is oftentimes used as of the over-the-counter stuff because it'll be at Walgreens, Walmart, that stuff. Don't shave your hair. Comb out of the nits after that. So if you buy of the red over the counter, you'll have one of those combs that you run through everything to get that out. Eyelashes, again, this is mostly with of the children, so we can coat it with some Vaseline, or if it's an infant, just some of the baby shampoo, right? Because we don't want them to, why is there Vaseline in mine, and rub it into their eyes, and no bueno. Body lice, again, permethrin. Yeah, head to toe, leave it on for 10 minutes and repeat. Permethrin again, the whole body. If you will be having this all happen down into the pubic area, not only are we going to use of the comb and that kind of stuff, but we're also going to check them for some STIs. So make sure that they didn't get something else because they got it in there. Okay? All types. Again, treat the family, friends, anyone in contact, retreat, wash everything on high heat. And there's what it looks like when it's focused into from, because it ain't that big. That is a part of the white fleck eggs. You can see this, it can happen all over the place. This is looking into of the hair area, focused all the way into it so you can see those eggs. See them here on of the eyelash? That is not a child's eyelid, but yeah, mostly there. More pictures. On the back, the next individual needs to get the largest comb ever, because that's all over the place. There's another one of the lice. Again, and that is of the comb that is oftentimes used with the over-the-counter stuff. It's very, very constricted, so it actually gets it out better than it could. All right, now let's get on to the fleas. Okay, tiny red dots of the ankles, lower legs. It is very, very itchy, which I don't know if y'all have had some pets that oftentimes if they have some stuff that is concerning to us, they are scratching everything all over, and what the hell is in there. Symptomatic treatment, antihistamines. If it's causing of a secondary infection, then we can do some of the antibiotics, we can use some of the steroids. Let's just get rid of all that stuff by treating if it's our animals that are coming and bringing it to us, and then also of the bedding. There we go. We talked about the feet and ankles. Those are the ankles. Going up a little bit more towards of that. It can cause some of the vesicles if it's more severe. All right, next up we're going to talk about all of my trips all over. I think next Friday and Monday I'm on leave because of the tournament is in NOLA, which is going to be Mardi Gras at the same time. So all those people there, yeah, I'm going to take all of my clothes to wrap up inside of this area. Then in April, which our course is done, it's up in Philly. And so, volleyball is damn expensive. All right, bed bugs. Exposed skin of a sleeper. Itchy, it's red, it's painful. Rows of 3 to 5 bites. Numerous bites can cause lymphadenopathy and fever. Look for those bugs at night. I look all over the damn place when I get in there. Again, I talked about the etiology stuff. Yes, it's Simics, but I'm not going to test y'all on that stuff. Get rid of bugs. Symptomatic antihistamines, topical steroids. That is what they look like. And that is how they grow. So a tiny of a penny, as they get to full of adult, it's probably the same as Lincoln's head on this, still small. But you can see how it starts off with of the eggs and it goes all the way around. So what do they look like for real? Are right there. So you can see that of the larger one is Lincoln's head. The other ones are still growing. They can cause, as we said, of the itchiness, of edema, of the redness. You can see that there on this individual's neck. It can also be on your back or of your abdomen. So you can see those spots there. Again, if you're in, if you're getting out of a bed and you're just itchy all over, then this could be concern. Military people have all learned about chiggers, okay? Tall grass, all of those things there. Intense itch management. it's of the over-the-counters. I don't remember, but I think we had some of this stuff deployed. I don't remember. I'm old. That's what they look like. What our skin looks like. Again, you can see it, it's of the feet and of the ankles because of the fact that we're walking in the tall grass or we're doing something and they climb up onto us. Fire ants. It's a sting. It's almost of the same thing as of a wasp or of a bee. It's not a bite, it's a sting. Immediate pain, wheal, vesicle, pustules. If it's intense and it's severe, then we will have to use some of the anaphylaxis. Groups of skip. Okay. It can. What we would have to do is we have to kill that entire of a flock, right? So all of the colony. Symptomatic treatment of the cool of the compresses, Sarna lotion, so it's an anti-itch, antihistamines, and of the steroids if it needs to be done. I'm pretty sure that if a patient is inside of an ER or they're seeing a clinic because they were bit by some ants, yeah, let's just go ahead and steroid them. There we go again. Ankle, foot, definitely the foot with all of the vesicles. The next picture, ouch. Like, did you fall into the pile? And da-da-da. All right, so that's the ants. Now let's get into the spiders. So there are 5 of the species of the brown spiders that can cause necrotic skin lesions, right? So these are more of severe ones. These spiders, yes, they are some enemies because of the fact that if we're in their area, if we see them and we want to pick them up and pet them, yes, that's going to irritate them, so then it can hurt us, okay? They are both in and outdoors, of the dark stuff, safe stuff, dry areas to hide. Brown recluse. On of their thorax is the violent too, but violent shape of the pigment. So it's easy to see that. It's upside down, but you will see that. The venom there, enzymes are responsible for necrosis, right? So it's going to start off and then it's just going to build and build and build. Here we can see of the violin, looks just like it. So this one of the brown recluse versus the one that we will talk next, it's painless. It's painless as it starts off. Several of the hours after that, you're going to be like, what the hell is this itching? Because I was working in the wood. I was in a garage. If I was doing something and I didn't feel like I was bit, but now it's there. 24 hours, then you start to have of the blister, of the bluish, of the coloration. 3 to 4 days, central area becomes ecchymotic. 1 week, necrotic ulcer, and expands for weeks and weeks and weeks. Okay, it can even have some of the Escher, which is of the black stuff, so it's dead skin. This is going to heal slowly, right? So if it's not A severe one, we're not going to treat this at all. It will go away. We'll just be trying to keep it as clean as we can. Okay, we talked about this there. You can see of the picture, that's that bluish color. The central area, it becomes ecchymotic. This is almost the same thing that we just read on the slide before this. Vasoconstriction, so the blanched skin around that area, because of the fact that we want of the blood to get in there and to help us out. Red, white, and blue could show you that. So the week after, you can have necrotic ulcer. I talked about the eschar, which is just there and it's already dead. Lesions may vary from the size, 1 to 30 of the centimeters, and it will expand over weeks up until the fact that it starts to heal on up. Y'all know that I got these slides from our wonderful Dr. Booth. It's easy to see because these pictures are from 1968. Systemic, fever, chills, nausea, vomiting, myalgias, petechiae. System reaction is more common in children than it is in adults. We're not going to have any of a lab test to confirm that we think what it is. Treatment or any with of the spider, there isn't any of the anti-venom. There's, if they're having the pain of myalgias and stuff, then yes, we can use some of the anal. We can do some of the shots. If it's really, really infected, then we can use some of the antibiotics. If it's taking too long, and you'll see some of the pictures here, we can do the surgical debridement of the alt, but that's if it's severe. If it's not healing on its own, then yes, we could go into that. We can also use some dapsone. We can do the hyperbaric to just clear it up. So here are some pictures of the day today. So right there, that is day 4. So that's when we can see the red, white, and blue right there. Gets in of the 2 days after, it's getting bigger. 4 days after, it looks like that. So I would say maybe that could be some surgical stuff, especially because the fact you can see of a bed stand, so that individual is obviously inside of a hospital. So hobo, found in the Pacific Northwest. Bite presentation is similar to the brown recluse. Treatment is also the same. So we're only treating for the symptoms, not so much for the wound in and of itself. Black widow, found throughout the U.S. Again, wood piles, basements, garages of the sheds, right? There are 5 of these, and only 1 of those has that orange-red hourglass. Hands and of the forearms are most frequently bitten. If it's in there, it can spread to your entire limb. Venom of the neurotoxin compared with any of an animal, massive release of the neurotransmitters. So acetylcholine, norepinephrine, that's what this is triggering on, and we release. Like I said before, with the brown recluse, it's not any pain at all. Like, you don't have it up until hours after that. Whereas here, if you are bit or stung, you know it right away. Okay, you can see that beautiful red hourglass, and you know that it happened. Pain spreads to the entire limb. Okay, it's not just going to stay in that one spot. It's going to go all over. 20 to 60 minutes after of the bite, we start to see some of the erythematous macule. That will show you what of the target lesion is, but like I said, it's going to go to other places in that area. Blanched center and of surrounding erythema. This one right here, you will have some of the muscle cramping and spasms that are of our core. Those are the pictures of that hourglass, as well as where that initial bite is at. And then you can see all of the erythema that is around it. How can we diagnose it? Well, we've seen it. We are having of the pain of the initial, and then also some of the muscle spasms that will occur because of the fact that we have released acetylcholine and the norepinephrine. Supportive care, again, we're going to, talk about injections. We will clean this stuff up. We can give them some opioids if they're having pain. We can give them the benzos for spasms. And then, of course, if they're going severe and they're going to be hospitalized, then we'll use some of the anti-venom. All right, so that is of the spiders. Next, we're going to go into cutaneous larva migraines. It's also known as a creeping eruption. That's just of an AKA. It's not in the Hobbit or of the other the textbooks. Most common skin disease among travelers to tropical countries. Back workers, so if they're up and under, that can happen. Back, ass, foot, and hand. The sunbathers on a beach because they're laying down and trying to get all that beautiful skin tan. Southeast U.S., right? So if we're down in Florida, Georgia, on vacation, then that can be locations of where it's at. Caused by accidental invasion of dog and cat hookworm. This one also makes some of the burrows. And while that is inside, it will eventually die. Topical steroids, if it's all inflamed. If it's very severe, ivermectin is what we will be using. So it's a single dose, but it could be repeated if it doesn't go. Ivermectin. We can also use albendazole. Topical version in small children, but in adults it can be an oral that will be taken times 3 to 7 days. Another picture that is worse, so we would want to give the ivermectin because this doesn't look like it's bueno. That one, okay. Let's use the topical stuff. That's widespread there. So that is of the migrants. So we talked about all of the things on here and what of the treatments are. We know that we do have some treatments, and the other ones we do not have any treatments because we're only treating the symptoms for those. All right, do we have any questions? Let me get set up with the next one. So let's take